morning, everybody.
Morning.
Thanks for being here. Thanks for having me. I'm going to talk today about the world of healthcare. There's a lot of opinions about how people feel about it and whether people feel the healthcare system is broken or not. But we're going to kind of dive into it a little bit in more detail with my presentation. My name is Neer Patel. I'm one of the co-founders of Virtuous Benefits and also DirectMed DPC. So in the center of the picture here, those are all of our physicians that work for us at DirectMed DPC. On the left there is my wife, Dr. Katrina Iqbal. We started this practice 10 years ago in Austin and have grown it ever since. And now we have offices in Austin and kind of in between Austin and San Antonio. We have an office here in San Marcos. That's our newest one that we opened last February. Dr. Beth Just, who's there on the screen, works for us there. And in 2020, my business partner, Angel Salcedo, who's on the left, and I started Virtuous Benefits, really with a mission to fix what we feel like is a very broken healthcare system. On the right of the screen is my family, my wife and my two kids, Ari and Kian. Family's everything for us, and that's the whole reason why we work so hard and do everything that we do.
Try again.
Cyclic.
What'd you say?
Was it just cyclic that used the word?
Say click.
Oh.
What?
That might be
Yeah, it's on presentation mode, it's just on split screen. Okay, that worked. Okay, there you go.
Thank you.
Yeah, I got you.
So I'll talk a little bit about our strategy at Virtuous Benefit. So we do a couple things differently than most other insurance people around the country. And we do this for businesses. So we're a nationwide agency and we teach businesses all over the country of all sizes how to do health insurance in a different way. And so the first thing we do differently is we rate the premiums logically. We take a snapshot of the health of the people that we're trying to insure. So if there's a company of 10 people, we take a snapshot of their health. Have you had cancer? Have you been in the hospital? What medications are you on? And we give that to an insurance company so that they can give us premiums that are logical and that are rated based on people's actual health, not assuming someone's really sick. And that gives us a significant reduction right off the bat by giving some transparency to an insurance company. The second thing that we do differently is we remove the network completely. So everybody's used to the big networks, Blue Cross, United, Cigna, Aetna, right? We remove those networks completely because when you do that, you are now removing essentially all of the greed in a health plan, i.e. all of the markups that get put on care. So I'm not sure if you guys are familiar, but if you called around any office or hospital or facility in the country and said, I have no insurance, but I have money, what's your cash price or your self-pay price or something? That price is generally 10 to 20 times less than the insurance price. So when you remove the network, now you're able to pay the cash price for all healthcare services that people need through the insurance. And then the third thing we do differently is we incorporate these direct primary care physician memberships into our health plan. So our medical practice that I mentioned, it's under the direct primary care model. There are thousands of these doctors around the country and new practices opening every single month. And this is because doctors, they don't enjoy being handcuffed by an insurance company and being forced to see 30 patients a day and delivering bad care to all of them. And so in this direct primary care model, physicians are free to practice medicine the way they were trained. And in medical school and residency, family doctors are trained to handle about 90% of everything that we need for our health. So when they do it through an affordable membership model, generally $100 a month for adults, half that for kids, and then they can give unlimited care because their patients are paying them just like a gym membership every month. So all the care is unlimited and all the access is unlimited. So you have your doctor's cell phone number, email address. You can think about it like a team doctor, like your favorite sports team, right? There's an athlete on the field that gets injured. There's always a team doctor, and that doctor knows those athletes really well. And when something happens, they run out on the field and they address it Nobody's trying to figure out what network does this athlete have, what doctor can they see, right? The doctor that knows them well runs out and addresses it. That's what direct primary care is. So what do we do at Virtuous Benefits? We're essentially moving from what's called fully insured, which is the traditional insurances that most people are on around the country, and we're moving it to what we call self-funding. So basically, in the fully insured model, they rate the premiums assuming everybody's sick because they don't give any health information to an insurance company. And then they just charge you a high amount and you pay that for 12 months. And then at the end of the year, they tell you, we're increasing this to 15 or 20% for next year. And that happens every single year, forever. And if nobody uses the insurance, they keep all the money. So on the self-funding side, we've got some buckets that kind of show you how we give transparency to our clients and show them we're rating the premiums logically, and then what is getting paid in, we're going to show you exactly what's happening to it. And if there's money left over that doesn't get used because you guys are healthy, then you're going to keep that money. This is our team at Virtuous Benefits. So myself, Angel, Sue, Queenie, and Shab are our care navigators. So care navigation is a really important thing that we have to do in this model. Because we're removing a network, our insurance card doesn't say Blue Cross or United on it, right? And so when you go try to use it somewhere, the first thing the front desk person, who doesn't take the money at the practice, by the way, will ask you is, what insurance do you have, right? And if they don't see a Blue Cross or a United that they're trained on, because that's who they have contracts with, then they're just automatically going to tell you, we've never heard of this insurance, we don't take it. And so in order to avoid that with all of the members that are on our insurance plans around the country, we have to do very high quality care navigation, which basically, the way we explain it to employees is you now have a concierge insurance plan and we're your concierge. So anytime you need anything, you just simply text us or call us or email us and let us know I need to go to the cardiologist, and then we will take care of everything so it all goes smoothly for you. We'll schedule the visit for you if you'd like, and we'll pay for it so that everything goes smoothly and nobody's telling you, we don't take your insurance. And we're simply just calling the billing office, the people who do take the money at the practice. We're asking them, what's your cash price for whatever services somebody needs? And then we're loading a credit card and giving it to the member so that they can walk in, pay for it with our credit card as a cash pay or self-pay patient, and it all runs through the insurance on the back end. So what's our biggest challenge? It's getting opportunities to educate people about this. There is this entire machine that unfortunately is filled with a lot of greed that is against us because there's a lot of money at stake, right? So these networks, they're overinflating costs dramatically, and that's how they make the bulk of their money. They don't actually make the bulk of their money off of the premiums they charge us. They make it every time we use our insurance card. And so, and then they've got brokers, right, insurance people all over the country that work for them. So they work for Blue Cross, they work for United, they don't work for the employers because Blue Cross and United is who's paying them. And so the Blue Crosses and the Uniteds, they tie the broker compensation to the premium that the employer and the employees are paying. So every year when you get that 15 or 20% increase, the broker is actually getting a raise. So there's no incentive for anybody to lower costs for people. And employers are fearful of trying something different, right? They've only ever known a network-based insurance. They've only known insurance-based primary care doctors. And so that's all they have experience with. So they're fearful of trying something new. And then providers who bill insurances, they're just simply not incentivized to keep patients healthy, unfortunately, right? So a primary care doctor, if you really think about it, they make you come in for every single thing you need. Even a routine medication refill that you've been on for 10 years, they still make you come in for that, right? Lab results that are generally normal, they still make you come in for that, make your payment, and then go over it with you. In direct primary care, all of that goes away because there's when a doctor is being paid on a monthly basis, there's no need to kind of have you come in for everything. And so they're incentivized to keep you healthy versus insurance-based doctors are incentivized the opposite way because they want you to keep coming in so they can keep billing your insurance over and over again. But getting opportunities to educate employers is our biggest challenge. And the ways that, the community can help us is, personal referrals, right? Thinking about specific employers, business owners, executives, HR leaders who might be frustrated with this rising cost and no value that comes along with it, and making a warm intro. Sharing our story with others, right? Like if you've experienced challenges with your healthcare and your health costs, and what I'm saying resonates with you, then sharing our story with others is important because people need to understand that there are different ways to look at healthcare. And then hosting lunch and learns and speaking engagements. Anybody that's very well connected in the community, your business circles, they need to know about these things. Businesses unfortunately have to be in the healthcare industry, especially when they're over 50 employees. They are forced to be in the healthcare business. And so we really need to get this education out to more and more business owners so that they understand there are affordable ways and very high quality ways to do healthcare. And that's basically it. I'd like to end with this slide, the psychology of change. We go through this on a daily basis with employers and employees, and it just kind of shows the trajectory of what happens. But I really appreciate everyone's time, and I'd like to open up for any questions.